You may be wondering what happens if you have hereditary cancer gene testing and you test positive for hereditary breast or ovarian cancer syndrome mutation. The goal is to try to help prevent you from getting cancer or reduce your recurrence if you've already had breast cancer or some other type of cancer. There are a lot of options, thankfully, that are available to you to help reduce those risks. For females who are BRCA mutation carriers, monthly breast self-exams beginning at the age of 18 and clinical breast exams by a healthcare provider should be offered every 6 months. Annual screening both with mammograms as well as breast MRI can be offered beginning at the age of 25 for BRCA gene mutation carriers. In addition, to try to reduce the risk of ovarian cancer, several strategies can be offered. Doing pelvic exams every 6 months beginning at the age of 35, along with a transvaginal ultrasound, can help reduce the risk of ovarian cancer. Doing a blood test for CA-125 also every 6 months can look for the protein, the cancer antigen 125, in your blood. This can be used to monitor certain cancers during treatment and also used to look for signs of ovarian cancer for people at a very high risk. For males that are hereditary breast and ovarian cancer gene mutation carriers, such as BRCA, they also have an increased risk of male breast cancer. So learning to do monthly breast self-exams for males, especially beginning at the age of 35, is also important. And in addition, they have an increased risk of aggressive prostate cancer. So doing prostate cancer screening annually beginning at the age of 45 is also recommended. Patients can also consider doing preventative surgeries. Preventative double mastectomies can reduce the risk of developing breast cancer by up to 90% in individuals who carry BRCA1 or BRCA2 mutations. We also recommend that individuals who carry these mutations consider having their children by the age of 35 if at all possible, and having preventative surgery to remove the ovaries and the fallopian tubes to not only reduce the risk of ovarian cancer, but by doing this, it also further increases the risk of developing breast cancer because you're removing basically that little hormone factory. Last but not least, chemopreventative measures, such as giving the medication tamoxifen or other related medications, can also reduce the risk of developing breast cancer in individuals that have a higher susceptibility. Birth control pills or oral contraceptives is another way that might help reduce the risk of developing ovarian cancer in women who carry BRCA gene mutations. So it's important to know, even if it's scary thinking about carrying a hereditary cancer mutation, there's a lot that can be done, fortunately, to help prevent you from getting cancers or reduce your risk of cancer recurrence. So knowing gives you power. Knowing gives you choices. It's really important to know your status and help protect yourself and the family that you love.